Welcome back, everyone. Dr. Jason Steinecker is with us from Lima Memorial Health System. He's a pulmonologist out there. We're talking about new technology. It changes, it grows every day, and you have a new way to kind of diagnose for lung cancer. If you could, let's go back in time, though. Tell us a little bit about the process now and what you do.
So absolutely, once somebody comes with a CAT scan that shows a suspicious nodule, based on the appearance and everything else, if there's a biopsy, we have currently two ways of biopsying. We have a CT-guided biopsy as well as a bronchoscopic guided biopsy. Now, nationwide guidelines recommend bronchoscopy with biopsy as the first line, as it is the lowest risk procedure. So what we have before the new system is ability to get to the majority of nodules, but there's still the inability to get to some nodules due to their area of the lung. And so those nodules would then go to CT-guided biopsy.
Okay, yeah. Tell us about this new procedure, less invasive, as you mentioned. Tell us what it does and then the changes it made. As you mentioned, those nodules, it sounds like it's really getting a clear picture.
Yeah, absolutely. So now we have the ion endoluminal system, which is a robotic bronchoscopy, which allows me, just like robotic surgery, to go into places with minimal risk as well as minimally invasive, just like the robotic surgical systems do. So now I'm able to get into any area of the lung and direct it to exactly where we need to go. And we do actually, during the procedure, we use a cone beam CT, which is a CT scanner. So we're actually CT guiding the robotic bronchoscopy now, which allows us to access 99.9% of anything in the lung with continuing that very low risk procedure.
It's amazing the technology you have. Walk us through, if we're a patient coming in and we're going through this biopsy, what we can expect.
Yeah, absolutely. So you come to the hospital, it's an outpatient procedure. So you come to the hospital a couple hour and a half early before your procedure. You get checked in, you meet with the anesthesiologist because we do it under anesthesia to make it easier for everybody. Procedure in general has been taking me about 30 to 45 minutes. And then you're asleep for the whole procedure. Once you're done, you wake up and you recover and you go home the same day. It's very, everybody that so far has had the procedure, no issues, a little bit of cough afterwards, but no soreness or anything that we've noted.
It is amazing to hear. As a pulmonologist, give me your thoughts on having this technology, knowing that it's more accurate, can see more things. And at the end of the day, when you're trying to tell somebody what you've seen as far as that biopsy, what kind of feeling, I guess, does that give you as a doctor?
Yeah, it helps because nothing worse than trying to do something and then you're not able to get somebody an answer that day and we have to go through something else. So it helps us to improve our accuracy and our diagnostics and ability to get somebody through the system as fast as possible. Because once we make that diagnosis, that's just the first step. They still need treatment. So the faster I can get the diagnosis, the faster they can get through their treatment and get on their way to a cure.
As you said, less invasive. I would think for the patient, obviously, they have to be appreciating that as well.
Oh, absolutely. Absolutely. Everybody wants to try and do what they can to not have to have any invasive scars or anything like that, or go through anything that they have to have something going through their chest.
Exactly. Dr. Steinecker, we love the technology. Thank you so much for telling us about it. We appreciate it.
Thank you so much.
You bet. Nice chatting with you. We'll be back after this.